What does imaging show about visceral fat and organs? Imagine looking inside the body and seeing not just the fat under the skin but the deep fat packed around your vital organs. That's what imaging techniques like MRI, CT scans, and DEXA scans can reveal. These tools give us detailed pictures of visceral fat, which is the fat stored deep in the abdominal cavity. This fat surrounds organs like the liver, pancreas, and intestines, and it's more than just extra weight. It's metabolically active and can influence your health in many ways. MRI scans are considered the gold standard for measuring visceral fat because they don't use radiation and can produce highly detailed images. They show the exact amount and location of fat around organs, helping doctors understand how much visceral fat a person has. MRI can also evaluate the organs themselves, checking for disease or damage that might be linked to excess fat. CT scans also provide high-resolution, three-dimensional images that allow precise measurement of visceral fat volume. However, because CT involves exposure to radiation, it's used more cautiously, especially in people who need repeated scans. DEXA scans, originally used for measuring bone density, have evolved to accurately assess body composition, including visceral fat. They expose patients to very low levels of radiation and can give a good overall picture of fat distribution. This helps doctors understand a person's risk for metabolic problems like insulin resistance, type 2 diabetes, and high cholesterol, which are all linked to excess visceral fat. Research using these imaging methods shows that higher amounts of visceral fat are strongly connected to metabolic disorders. It's also linked to inflammation and vascular issues that increase stroke risk. Studies have found that people with more visceral fat tend to have more signs of cerebrovascular disease, such as white matter changes in the brain and plaque buildup in arteries. This means that visceral fat isn't just about weight, it's an independent risk factor for stroke and other vascular problems. In clinical practice, imaging helps identify individuals with high visceral fat who may need targeted lifestyle changes or medical interventions to lower their risk. While measuring waist circumference is a simple screening tool, imaging provides a precise assessment that can guide personalized treatment plans. By understanding how much visceral fat a person has and how it's affecting their organs and blood vessels, healthcare providers can better manage and reduce stroke risk. In summary, advanced imaging shows that visceral fat is a highly active fat depot closely linked to organ and vascular health. It plays a significant role in increasing the risk of stroke and other cardiovascular diseases. These imaging techniques allow for accurate measurement and help tailor prevention strategies to each individual. Always remember to consult healthcare professionals for personalized advice and risk assessment, as each person's health profile is unique.